Thank you.
Next speaker is Dr. Vishnu. He's a glaucoma consultant at Ashwini Netralaya, Tripura.
Good morning, everyone. I'll be talking about the topic how to focus on the points of Humphrey field analysis to reach at a proper diagnosis. So we all know standard automated perimetry is what we use to see the central 30-degree of the field. Basically, we are seeing how much sensitivity is measured in all the points of the retina. So basically, there is a threshold. We calculate the threshold, which is actually 50% of the 100 stimulus given. Patient is supposed to get 50% of the stimulus, and patient is supposed to miss the 50% of other stimulus. And 0 decibel means maximal stimulus intensity is used, and 50 decibel means 0.1 minimal stimulus intensity is used. So things to watch, we have to see the proper ergonomics of the patient if they are seated properly, and the testing programs include 30-2, 24-2, and 10-2 macular program, which measures the points 76, 58, and in 6 degrees apart. And the strategies include full threshold, CETA standard, faster, and fastback. So these are the point distribution we all know. So what is the Humphrey field analysis? It's divided in 10 zones, zone 1 to 10. Zone 1 include patient data. So basically, we are comparing the age-matched individuals. Patients' data is compared to the age-matched individuals. So the age is important. Second point is refraction. Refraction is important because even one diopter variation causes 3.6 decibel generalized depression in the perimetry. Then pupil diameter should not be less than 3 millimeter because again there will be decrease of the sensitivity. Stimulus size normally used is Goldman size 3 stimulus. Then background illumination used is 31.5 apostilus, which is used to saturate the photoreceptors, so that the test is done in a photopic condition. Then we use full aperture lens as well as the liquid crystalline lens. Then coming to the reliability indices, fixation loss less than more than 20% makes it reliable because stimulus is given to the blind spot. So it's the total number of times the patient respond to the stimulus divided by the total number of presentations. So intense stimulus is presented to the physiological blind spot, and the patient is not supposed to see that. And fixation loss is calculated by Hegel-Karakull method, which is about the 5% of the total throughout test. So other methods include gaze tracker, in which infrared light is projected onto the center of the pupil. So false positive, which is most important. False positive indicates that he or she is seen as stimulus when one was not actually presented, and more than 50% shows poor reliability. So this presents as white scotomas because of a trigger happy patients, or it can present as an inverted cataract pattern in which there are more points in the pattern deviation probability plot than the total deviation probability plot. Now, false negative, it's a failure to respond to stimulus that is at least bright or brighter than the one which was previously the patient has responded. It shows the patient's fatigue, and more than 20% shows poor reliability. So this shows a cloverleaf pattern, high false negatives. Then foveal threshold, if there is a 1 dB fall for every decade, and normally it is 35 decibels. Then zone 3, which is used to educate the patient regarding how much of the field loss for a layman perspective of view. The zone 4 includes the threshold values, which is actually the measured retinal sensitivity of the patient. Zone 5, total deviation numeral plot shows the point to point deviation from the normal age-matched individuals corrected normal sensitivities. So the negative decibel value indicates the depth of the field defect, and the higher the negative negative decibel value, it shows deeper scotomas. Now, total deviation probability indicates the probability of the occurrence of deviations that falls outside the statistical range of the normal sensitivity. In other words, it is shown in p-values less than 5%, 2%, which means that the probability of finding a defect, for example, less than 2% means the probability of finding this defect is in a normal patient this would not be present for at least 98%. Then pattern deviation numerical plot. It is derived from the total deviation plot by subtracting the generalized depression and focusing on the localized glaucomatous defect. So it is calculated by the 7th most sensitivity point. This is just an example, but it will not be always correct, because the 7th most sensitive point, or 85th 85th percentile, is subtracted from the total deviation plot and made it at 0. So pattern deviation probability plot increases the probability of occurrence of that deviation in the normal population. So this is what we basically use in glaucoma diagnosis. Then coming to global indices, mean deviation is actually the total average of the total. It is derived from the total deviation plot. It is average deviation from the normative data of all the threshold points except that of the blind spot. So indicates overall deviation from visual field from the normal. So this is normal hill of vision with space for the blind spot, and this shows the patient's generalized depression. And pattern deviation, pattern standard deviation is also derived from the deviation plot. It shows how each points from the differs from the adjacent points. So it shows localized defects of the patient. It gives an idea about the resemblance of the patient's field to the shape of the total hill of vision, but it is not used for staging or progression index. It basically shows the potholes or defects in the same vision of the patient. So this shows generalized depression with a localized scotoma. And this is generalized depression with hidden localized scotoma. The visual field index, it gives central test points more weightage. It basically sees the functioning of the ganglion cells. So visual field is, VFI is 100% normal fields and 0 in perimetrically blind fields. Zone 10 basically compares the its glaucoma hemifield test. It compares the 5 zones mirror image above the horizontal meridian, superior and inferior, and it is matched with the age matched individuals. So its result comes as outside normal limits, borderline. Outside normal limits, at least one zone pair differs by an amount of found less than 1% of the normal subjects, and borderline means less than more than 1% but less than that of 3%. Generalized depression, even the best test points have low sensitivity, has to be seen in fewer than 0.5% of normal subjects. And abnormally high sensitivity best test points location is so high that it's not less than seen in 0.5% of normal subjects. So this is an example of, and we diagnose using Anderson's criteria. So 3 or more non-contiguous points, non-edge points in a 30-dash printout, or 3 or more contiguous points in a 24-dash printout with a p less than 5%, out of which at least one has p less than 1%. And pattern standard deviation should have a value less than 5%, p value less than 5%, and GHT outside normal limits. So glaucoma grading scale is used by Hoda-Parrish-Anderson criteria. So early defect is more than 6 decibel, and a cluster of which we all using Anderson criteria. And stage 2 is moderate defect, 6 to 12, and stage 3 is advanced defect, and stage severe defect is more than 20 decibels. And stage 5 is end disease, and the patient is unable to perform the HVF. So this is showing a 24-2. So the central point is more affected. So we go for a 10-2 and macular split seen in the one of the macular program. Thank you.